Thank you, Vic. I think what I'll do is I'll sort of talk about three different altitudes that this relationship is working to address issues. 30,000 feet is the fact that in the United States we are experiencing right now a tremendous underachievement. We're spending almost 20% of our national economy on healthcare outcomes, and we have declining healthcare outcomes in the United States. We've gone from a position of prominence among the OECD countries, the industrialized countries, to where we're now ranked 24th in healthcare outcomes. So if you look at where we are, what we see is massive expenditures, $17,000 per person per year for healthcare outcomes, and we have a declining overall national outcome relative to healthcare, not to mention the inequitable distribution of those healthcare benefits as they affect our broader population. So at the 30,000-foot level, clearly something is wrong. I know that the Mayo Clinic is deeply committed to changing that outcome, and Arizona State University can be their partner by doing something which is to actually start talking and thinking about outcomes, start talking and thinking about national health care outcomes, which is a completely new way to get engaged, and it's the kind of way that Arizona State University has positioned ourselves and our intellectual assets to focus on all of this. So if you go from 30,000 feet to 10,000 feet, now things change a little bit more. Now you're looking at the emergence of health delivery organizations like the Mayo Clinic and the emergence of teaching delivery organizations such as the university. And what you see over time is that, in fact, these two types of organizations grew further and further apart. Not that medical organizations didn't build medical schools and nursing schools and so forth, but they built those as specialty schools. And the other disciplines in the social sciences and in teaching and in pedagogy and doing other things, those became further and further separate from the clinical organizations. And so at 10,000 feet, we see a fantastic opportunity for Arizona State University, which grew out of a teacher's college tradition, which expanded from its teacher's college tradition to now engage in teaching, learning, and discovery, to take that teaching, learning, and discovery activity that we have, spread out across dozens and dozens and dozens of disciplines, social work, economics, engineering, science, a very broad spectrum of disciplines, and find a way in which we can now work with the Mayo Clinic at increasingly more focused ways at how do you take the clinical organization and the teaching organization, in a sense the doctors and the teachers, the doctors, the nurses, and the teachers, and now bring them together to achieve this improved healthcare outcome objective. And so what we're really doing today is announcing one step that we're taking along that process, because, and I want to go down to the 1,000-foot level for the step that we're actually announcing. So at one of the foundational platforms through which new clinical outcomes will be derived is the notion that somehow we can personalize medicine down to the individual. And medicine not just for the individual who's arriving at the clinic or at the hospital, but the individual who's just living their life at home or at work or wherever they happen to be. Well, to do that, and to take advantage of all of the new knowledge coming in from human genomics, and to take all of the new knowledge coming in from sensors and detectors and other kinds of things, as well as all of the complexity of where we live and how we live and so forth, it turns out that a foundational area of science and technology that will transform healthcare delivery is biomedical informatics. And so it is only logical in the context of trying to derive new overall healthcare outcomes, and only logical in trying to build a new relationship between a comprehensive university and a comprehensive clinical organization, that we would then take as a major step the bringing together of a biomedical informatics as an academic discipline, as a teaching, learning, and discovery discipline, marrying the two organizations around this discipline. So we're very excited at Arizona State University to be able to partner with the Mayo Clinic organization. They have the same cultural prerogative that we do, which is to be of maximum service, to be of maximum impact, and to figure out actually how to change people's life outcomes. That's why we exist. That's what we do. And this is one step along that path. I want to go back to the 30,000-foot level. It's not working in the way that it should on a national basis. At the 5,000-foot level, universities and clinical organizations became truncated apart from each other over the last few decades. This is a way to bring us back together. And at the 1,000-foot level, we're fantastically excited about the opportunity to move the Department of Biomedical Informatics into the Mayo organization, into the Mayo facilities, and to be a part of everything that sits there in terms of foundational knowledge and teaching moving forward.